Hi, hello everyone, welcome back to our channel Medical Coders Coaching World CPC. In this channel you are going to see about the coding guidelines and easiest way to find the answer, tricks and tips to find out the answer. If you still not like our channel, like it, and if you still not subscribe our channel, subscribe it and press the bell icon near to the subscribe button. Come, let's go into the world of medical coding. In this video we are going to see about the last chapter of ICD-10-CM, chapter 21, factors influencing health status and contact with health services, which means the codes which we can use in the health status of the patient to describe the health status of the patient and the health services provided to the patient. The code ranges from Z00 to Z99. In this chapter we are going to see some additional information about Z category codes, and it can be used in any healthcare settings like inpatient, outpatient or clinical care settings. Like in any healthcare settings we can use this Z category codes, and it can be assigned either as a principal diagnosis and as well as secondary diagnosis. Some Z category codes can be assigned only as the principal diagnosis, and that also we will see in this video. Then these Z category codes are not a procedure codes, but it should accompany the procedure codes to describe the procedure performed. The procedure code should accompany the Z category codes to describing the procedures performed procedure. Next topic is categories of Z codes. In this first we will see about contact and exposure, which means Z20. This code description is contact with unsuspected exposure to communicable disease. A person who doesn't have the communicable disease but they are in the suspected exposure or in the close contact with the infected individual means then we will use Z20 codes, Z20 category codes in the person's record. And Z77 category codes description is other contact with unsuspected exposure which is hazardous to health. If a person is having any other contact with which is not good for health, which is hazardous to our health, or under suspected exposure which is hazardous to the health, which means in that case we will use Z77 category codes in that person's record. This contact and exposure codes can be a principal diagnosis code, and the secondary diagnosis code we can use as risk identification codes. We can use as the secondary diagnosis for this person. The next topic is inoculation and vaccination. Z23 category codes are used for inoculations and vaccination. If there is any vaccination given for the patient against some disease, then we will use Z23 category codes in the patient's record. And the procedure codes, we will use the procedure codes along with Z23 category codes that can be used for administer and to identify the type of immunization given. And Z23 category codes can be used only as the secondary diagnosis. This Z23 codes can be used as the secondary diagnosis along with the procedure codes. And the next one is status code. This status codes gives the information about the patient current status and to describe about the patient's current disease or sequelae of the current disease or the past disease. These status codes are known as informative codes because it can affect the course of the treatment and outcome which is given to the patient. And the history codes and the status codes are totally different codes. Z14 it is for genetic carrier code, and Z15 it is for genetic susceptibility to disease, which means an individual might have the gene which may increase the risk of the person to develop the disease, to develop certain disease. In this case, without developing the certain diseases, we should not give this Z15 as the principal diagnosis. Here we have to give current condition as the principal diagnosis and Z15 as the secondary diagnosis. Next one is history code. There are two types of history codes. One is personal history code and the family history code. Personal history code means a patient past medical condition and the treatment taken for that medical condition, and if the condition is still present then it will comes under, these are all comes under personal history code, personal history. And the family history means a patient's family past medical histories or current medical history, that will comes under family history. And the screening codes, Sometimes the screening codes we can give as the principal diagnosis. Some examples of screening codes are Z11, it is for the encounter of screening of infections and parasitic diseases, and Z12, it is for screening of neoplasm. Next one is observation codes. The observation codes are 3 observation Z category codes we are having, which can be only used as the principal diagnosis, and some of the common guidelines for the ICD is history codes are always be the secondary diagnosis, and sometimes we can give the screening codes as the principal diagnosis. The code category A to T, it describes about the condition, and the immunization or vaccination codes can be given as the principal diagnosis if it is given to prevent any condition. If the immunization or vaccination is given a part of the routine OP visit, then it should be given as the secondary diagnosis. The code with the symbol PDXIN, it should not be, the codes with the symbol PDXIN should not be used as the principal diagnosis. So these are the coding guidelines for chapter 21. In the next video, I'll upload the details about coronavirus coding guidelines, which is newly implemented by AMA. So stay tuned. Till then, bye from Bhumadevi Chandrasekharan. I hope you all like the video. If you like the video, please do like, comment and share. And if you are still not subscribed our channel, kindly subscribe our channel and press the bell icon near to the subscribe button. Then only you will get all the notification of our channel. Thank you from Bhumadevi Chandrasekharan.